The government says it will continue to release daily COVID data despite protestations from prominent Tory backbenchers. Former Tory leader Duncan Smith claims that the regular updates are spreading fear and exaggerating the importance of these statistics.
Stop it now. We are publishing daily figures on COVID, but why aren't we doing the same for pneumonia or, when the time comes, flu? The problem is it feeds the whole fear factor and makes decision-making by the public irrational. We need to understand the balance of risks, but publishing these figures every day makes it seem like nothing else matters. They should stop it and do it now.
Britain is experiencing over 20,000 new COVID cases, the highest since January. But the lockdown and vaccination rollout have meant hospital admissions and deaths remain relatively low. The health authorities don't publish the data on any other disease in the country, which some MPs argue gives a full sense of the risks involved. COVID dropped to the 31st leading cause of death in May, with the biggest killers heart disease, dementia and Alzheimer's. But some argue the daily data serves as a timely reminder to be vigilant. And the government says that failing to publish would be wrong.
That substantial data set to share, whether it's published, on the front page of a newspaper every day, or whether it's something that those who are monitoring and making sure that, they're looking after us have at their fingertips.
So, is it time to put a pause on publication, or does the data still deliver a purpose? To talk about this, I'm now joined by journalist and social commentator Sonia Poulton and the director of the Centre for Decision Research, Professor Peter Ayton. Thank you both very much for joining us. Now, Peter, people are running scared and acting irrationally. Why should we keep publishing these figures?
Well, I don't see any evidence for an irrational reaction to the particular figures. Now, I'm by no means denying the fact that sometimes people do react irrationally to risks. Typically, however, when they either have no information or poorly published information. Information can often be misleadingly presented. But the extraordinary thing about Duncan Smith's reaction is that he wants to prevent people from reviewing simple numerical facts, which are not in any dispute. I'm all for contextualizing information, understanding the relative risks of different hazards and so on. And so, I'm surprised he didn't call for some greater context to be put around the figures. I'd be all for that. But to deny people access to the figures just seems really quite paradoxical.
But there are claims the data is unreliable, aren't they? And because they're saying these aren't today's cases or deaths, the actual day's figures, but those recorded today, which is different.
Yes, I mean, there's always caveats placed around data of all kinds. I mean, all data, can be unreliable to some degree or another. That, I think, is understood by the people producing the data. They wouldn't deny that. And indeed, by many of the people receiving it. But, nonetheless, there is value in that information. It's not completely random numbers. They have some relation to reality.
Sonia, the government says it would look like they're being secretive if they stop releasing these figures, and that's fair enough considering they're under serious scrutiny. People say, well, this is just a cover-up.
Yes, indeed. I find myself in an unusual position, Bill, in that I actually agree with something Duncan Smith has said. But I guess a stop clock is right at least twice a day. The fact is that we need to stop publishing these daily cases for COVID. Not only are they unreliable, but they're a poor indicator of how many are hospitalised or dying. And the government's right. Yes, it would look as if they've something to hide, but we thought that all along. Because the truth is that we cannot rely on these figures. The PCR testing on its own is unreliable, and it's proven to be so. It's costly. It's creating unnecessary and immense fear for people. It's been problematic from the get-go. We have false positives, even false negatives. I've had 2 COVID tests, and despite serious symptoms, they came back negative. My doctor said they're wholly unreliable, and at least a third of them cannot be trusted. People have tested fruit, and they've received a positive test.
But Sonia, that does happen with many scientific tests, doesn't it, really? We can't be absolutely certain.
It certainly does, but listen to what you said in the intro, and that is COVID is down to the 31st in terms of problematic illnesses. Why is there still so much attention given to this? It's outrageous. We know that people are dying unnecessarily through heart disease, through cancer. People are going undiagnosed because of our total focus on COVID. So yes, these daily numbers
Peter,
are absolutely problematic.
Why so much attention, and bearing in mind there could be a false sense of risk here?
Yeah, I mean, there is some some reason to this argument that other causes of death may be being neglected at the expense of the attention given to COVID. This actually happens in other contexts with risk. For example, not so long ago, billions were being spent on the war against terrorism and the massive amounts of money spent on security at airports and other places. Which could have saved many more lives. There are plenty of analyses suggesting that, had the money been spent in other ways. Nonetheless, with respect to COVID, and I accept the figures have errors around them and they won't be perfectly reliable, but they give us a sense of the order of magnitude of the threat. And particularly at the moment where we're obviously about to see an upturn in number of cases, which has at the moment an uncertain implication for the number of hospitalizations, impacting on the health service provision, and indeed deaths. And, there are still more than 5 billion people unvaccinated throughout the world, serving as a sort of cultivation center for new variants of the vaccine. So we really need to keep our eye on it.
Sonia.
Well, I have loads of problems with this. One is, what is the definition? The problem with the testing is there's no set definition of what a case is. The only criterion is a positive result. And as I've said, fruit has been tested positive. It's an issue because in any other disease, you would have a clearly defined outcome, which would involve signs and symptoms of a sickness. And as many great doctors have told me, the PCR test does not equate to COVID-19, even though the loose definition applied to it does. So we have problems there. The cost up to March, £37 billion on test and trace. It's been an abject failure, serving only to line the pockets of Serco, Amazon, and the likes of Dido Harding. So I have a lot of problems with it. I don't think that it's representative of what's going on. It's certainly not representative of hospitalizations or indeed those who actually have COVID.
But Sonia, isn't this, though, a great way of keeping us vigilant of what many perceive to be an ongoing risk? Because many other diseases, they can't be stopped. But this one, if we acknowledge good hygiene, vaccines, social distancing, this can actually be curtailed.
We've done all that. The only thing that this testing does is keep us in lockdown and keep us restricted. And as we've seen this week, restrictions are for the plebs. The whole thing has become a nonsense. Leaders are hugging each other at G7. Football and Wimbledon has returned. Executives who make more money can come out of restrictions. This is no longer about a virus, but about control. And it's time to live with whatever it is. And the amount of money that has been ploughed into this is outrageous when you look at what's been happening with our NHS. So I think the problem is, and also, the figures are an issue, Bill, because our restrictions and our freedoms are dependent on data, and the data is problematic. What we should be doing at this stage is looking at we need impact assessments. What has lockdown done to us, to our businesses, to our livelihoods, to people's lives? I've interviewed people who've said goodbye to their loved ones in care homes and never got to hug them again. So there are many, many, many problems, and a lot of it is reliant on testing that is problematic from the get-go.
So, Peter, in reaction to what Sonia says, isn't it time that we just live with this virus now and just get on and pursue normality?
Look, the waste of money on various aspects of the government's plan, I can't possibly defend that. And the test, track and trace is, widely understood to have been a complete failure. But this is completely tangential to the idea that we actually regard information. The policies and the actions are, available there. They can be critiqued and, changed. But we need information. And the idea that we should just simply, stick our heads in the sand and deny access to information just seems to me completely indefensible.
Just one final reaction. Last word with you, Sonia, because we're nearly out of time.
Well, the only thing I would say is that it isn't irrelevant what I'm saying. It's very relevant. Let's look at what's going on in Lisbon, for example, where a Lisbon court has ruled that only 0.9% of verified cases died of COVID-19, as opposed to the 17,000 that the Portuguese government were claiming. So the fact is there are problems all round, and the UK is not excluded from that. So no, we definitely don't need those daily figures. Absolutely not.
Peter, I've really got to get you to respond to that just finally then.
Well, there's nonsense throughout the whole of the story of the pandemic. I mean, I can't possibly defend that. All I would say is, we need information, and the idea that we should just disregard information because it's not perfectly reliable. Most information that we make decisions on is not perfectly reliable. That's a fact of life, but we have to get what we can and deal with what we have.
Really good discussion.
Doesn't need to us be in lockdown, though, does it?
All right, we've got to stop there. Really good discussion. Thank you so much, Sonia and Peter, for joining us live here on RT UK. Thank you.
Thank you.